Hi guys, it is me again with something very important that you really want to know. I know you really want to know about it. So before I start, let me tell you a story. So there is some 3 years back when I was sick and I went to the hospital, and so I went with somebody, okay? Then after being treated, I went somewhere to sit to get rest. Then there was a young lady who approached me and asked me if I'm working in that hospital or if I know someone in that hospital who can help her. I told her no. She was a young girl, by the way. And then I told her, no, I've just come to get treatment. So I asked this lady, why are you asking me such questions? And she told me that she wanted to abort the baby. And I asked her why. She told me that the person who is taking care of her, that is her uncle and the grandmother, will not tolerate her when she tells them that she's pregnant. I told them, no, just keep the pregnancy. So it's like this girl, from the story, it's like this girl was used to aborting, getting pregnant, then terminating the pregnancy. So she told me that she has been doing that several times, and she's not aware. She's not worried of anything. So I told her to give me her number so that we will be able to communicate. Of course, I tried to tell her about the complication that might arise, and she was like, no, I just have to terminate this pregnancy. So after 2 days, I called her, but she was not able to pick the call. After some 3 years, that is just recently, she called me and explained to me what she wanted, and I could remember where we met. So I told her, okay, she was telling me that she got married and at that time she was trying to get pregnant and she could not get pregnant. So today what I want to tell you is complication. The most important thing that I want you to know about this video is complication of abortion, because you find that so many abortions are happening behind the doors, and there is no one who is communicating about it. So please, today I want you to know some of the complications that might arise when you do unsafe abortion. So before I forget, please, if you have not subscribed, please subscribe, comment, share, like my video, and tell me what you want me to make video about in the comment section. So let's go. We will start by defining what is abortion and what is miscarriage, and then before that, I will also tell you about who is at risk of getting abortion, and then some of the complications, and how can you know that you are having abortion or you are miscarriage. You have miscarriage. So you get that in some countries abortion is allowed, and some countries like Kenya, abortion is illegal thing. That is why you find that behind the doors there are so many abortions that are happening, and I have so many stories. I know so many people who have aborted, and they are just there. They are just living a normal life. So another thing that I want also to know I want you to know before before I go straight to the content, is that some cultures, they have some myths. I don't know if it's okay. Some cultures believe that abortion is a taboo, and some cultures believe that when you abort, it is just okay. And then also another thing, there are some of the myths and misconceptions about abortion that I will tell you in the video. So before we continue, let me define for you what is abortion. Abortion is termination of pregnancy. The abortion is the termination of pregnancy before term. And abortion that take place without any attempt, it is called miscarriage. That is the layman language. I don't want to talk a lot more, what even am I saying? I don't want to talk more of what medical terms. So who is at risk of getting abortion? By the way, who is at risk of getting abortion? There are those people who have abnormal uterus. You get that there are some uterus which are divided into two. There are some uterus which are cone in shape. There are some uterus which are let me say just abnormal uterus, because even if I say I define those types of abnormal uterus, it will not be very important. So let me stick to abnormal uterus. Another thing, those who have thrombophilia, it is a condition that increase blood clot. Yeah, that increase blood clot. And therefore, if you have this condition, you will end up having miscarriage or aborting the baby or having abortion. Another thing that I have, another person, or the person who is at risk of getting abortion, when you are pregnant and you get trauma, somebody beat you on the abdomen. When you are pregnant, you can get abortion. Another one is what? Another one is how do you call it? Fetal abnormality. So that the pregnancy cannot continue up to term. Another thing that can also cause abortion, those who are having some chronic illness and they are not managing them well. Like someone is having diabetes mellitus and this person is not managing it well. And also another thing, another example, somebody is having hypertension, and this person is not managing it well. This person, if she gets pregnant, she can end up getting a miscarriage. There are so many of them. Those are just examples. But what I want you to know today are complications of abortion. Number one, because this complication usually happens when you do abortion behind the door. You do unsafe abortion, let me call it unsafe abortion. They usually happen when you do unsafe abortion. You get that somebody just gets some quack in the village, or they use herbal to terminate the pregnancy, and you find that this sometimes they bring a lot of problem in future. Like the lady that I've told you, she was traveling, I think she was using herbal medicine to terminate the pregnancy, and there was no treatment. Maybe sometimes she was having complication inside the womb, that is why she cannot get pregnant. So let me quickly go to complications that might arise when you have unsafe abortion. Number one, if you are used to getting abortion, you abort one, the first baby, the second baby, you might have incompetent or loose cervix. In future, when you want to get pregnant, the cervix will not be able to hold pregnancy up to term. You will be getting more miscarriage, every miscarriage, and sometimes you might not know. You will, some people, I usually hear them say, I when I get pregnant, when I reach this month that I aborted the other baby, I end up, I get miscarriage again. So that is what usually happens. You are used to to aborting the baby, and in future when you want to get pregnant, you cannot carry the pregnancy up to term. Another thing that usually happen, you can end up infecting the womb. Remember, this baby is not fully formed, and then you are using some medicines. Some people even put some sharp object inside the womb. They are making the womb to, I just don't know. So you get that your womb will get infected. It can get scars, and even sometimes you can end up getting abnormal growth in the womb. Therefore, in future when you want to get pregnant, or when you get pregnant, you will be getting miscarriage. Another complication that might arise when you have several abortions is what? Let's say, for example, this was your first pregnancy, and you ended this pregnancy without nobody knows. And for example, you are a blood group negative, rhesus negative. You will get sensitization, and therefore in future, every time you will get pregnant, you will be getting miscarriage. Every time you get pregnant, you will be getting pregnant. And you will end up saying, blaming people, blaming yourself, blaming God, and you're the person who caused this problem to yourself. Another thing that can also happen, you can get infection that is you cannot treat. Yes, some severe infection that will take time to get treated. That is, it is sepsis. You will get infection that we call it sepsis. That sometimes you can even die. Sometimes another thing also that will happen when you just abort, or when you are doing abortion, is excess bleeding. You can bleed until you die. So I just want to discourage, or I just want to, when you get pregnant, even if there is nobody who is responsible for that child, in future you might end up getting a lot of complication. Just avoid this complication by avoiding abortion, unnecessary abortion, or in short, just abstain until such a time that you want the baby. And if by bad luck you were raped, or you can go to the hospital immediately and you get emergency pill. If you have not watched my previous video talking about the P2, the emergency contraceptive or emergency pill, so that you cannot get pregnant. If by bad luck you are being raped or something, I think you just go to the hospital and get this emergency pill, so that you avoid unnecessary abortion. It is always bad in future when you want to get pregnant and you cannot conceive, because something you could have just avoided, and you have just ignored. So stop blaming people, or stop blaming God. Some people say that because I aborted one child, now God cannot. Even it's also God can punish you, of course. Therefore, I just want to tell you that sometimes just avoid unnecessary things which you can avoid. Something like abortion, you can avoid it. If you don't want to get pregnant, go to the hospital, explain your problem, you will get help. Okay? Thank you very much for watching my video. Let's meet in my next video. I will also be talking another thing that is very important that you really want to know. Bye.